All right. Well, welcome, welcome, welcome. My name is Meghan Sahli-Wells. I am the mayor of Culver City, and I'm very happy to welcome you to this extraordinary panel as part of our general plan speaker series. Tonight, we're going to talk about health. What makes a healthy city? In one of my more controversial tweets, I said that we've planned our cities for obesity, death, pollution, and climate change. Why is that? Because we're dependent on cars. We don't necessarily have access to healthy food and to go where we need to go without driving a car. We've designed our cities historically for the outcomes that we see in our society, which I don't think were the intended outcomes. But what we can do is work together to redesign our cities. Redesign them so you don't have heavy polluting industries right next to schools and residences. Redesign so that you can walk to get your groceries, walk to school, walk to work. Design our cities so that we have enough housing to house our residents at a price that they can afford. All of these things are incredibly important. Designing for different ages, different abilities. These are the things that cities do and that cities need to do. And because we're updating our general plan, this is our golden opportunity as a city to redesign the city in a way that will benefit the residents and help us to be healthy. So I'm really proud of the outstanding panel that we've put together this evening. We've got Stepahanie Ramirez, who's the Associate State Director of Community at AARP California. Stepahanie, you want to wave? We've got Gayle Haberman, who is the Director of the Office of Planning for the Los Angeles County Department of Public Health. Gayle is also a Culver City resident, so we're really lucky to have her. We've got Louise McCarthy, who is President and CEO of Community Clinic Associations of Los Angeles County. Louise, so good to see you. And we have Tom Kelly, who is the Interim Executive Director for the Westside Regional Center. Each of the panelists will give a presentation, and then after that we will have some questions and answers. But first, let's start off by giving a big round of applause to our panelists. And Stepahanie, are you going to lead us off?
I am.
All right. I'm going to leave it to you.
All right. Thank you so much, Mayor Sahli-Wells, and thank you everyone for joining. I know we were talking that this time of year gets a little tricky with the holidays. It's a little colder. I say that because some of my coworkers that are from the Midwest make fun of me when I say that. You can tell that I was born and raised here, so I have no idea what seasons are like. So my name is Stepahanie Ramirez. I'm an Associate State Director with AARP California. And we have AARP is one of actually the largest membership association in the United States. We have 33 million members, 37 million members, with about 3.3 million members residing here in California. We have state offices in every state, including some U.S. territories, such as the Virgin Islands and Puerto Rico. So our reach is pretty far. We were founded 61 years ago by a retired school teacher, actually with history here in Los Angeles. She was the principal, the first female principal of an urban school in Lincoln High School in Lincoln Heights in Los Angeles. And she founded AARP when she found one of her former colleagues, who also was a school teacher, living in a chicken coop. And she thought, that's no way to age. And thinking about, particularly she was an educator who gave her life teaching the next generation. And so thinking, like, is this the way that we're treating people who really are public servants? And sort of being able to realize that there was an opportunity to advocate for the well-being of teachers at the beginning of the founding. So AARP actually was started as the National Retired Teachers Association, and that became the acronym that we know now, which is AARP. So just giving you a little bit of history of the organization that I represent. And I know that we're here to talk about healthy communities. And so I'm going to provide a little bit more of a big picture of what we like to call a healthy community, and that's an age-friendly city, a livable community, and that's encompassing great places for all ages. And so hopefully you can see the image here. I put a lot of images, so you'll be able to get a little bit more of not just images. I'm sorry, not just text. But so why does AARP care about livable communities? So as you know, AARP is an organization that we're focused on the needs and wants of the 50 plus. So our mission is enhancing the quality of life for all as we age. And I say for all because nobody woke up this morning younger than they were yesterday. Right? So we're all in this process together. Some of us might be in a different stage, but we're all getting older, and that's a great thing. So a livable community is a community that is safe and secure, that has affordable and appropriate housing and transportation options, and has supportive community features and services. Once in place, those resources enhance personal independence, allow residents to age in place, and foster residents' engagement in the community's civic, economic, and social life. And so when we think about it, it's really a place where everyone can thrive. You know, we're not talking about something completely a different vision for folks, but really thinking that a lot of this work takes place in local communities. And so I'm going to talk a little bit about how we envision a place for all people to prosper. And so why is this important? So we've entered a time where our demographics are shifting. So as recently as 2010, people aged 65 and older represent 13% of the population. But by 2030, older adults will represent 20% of the population. So that's almost a doubling of the demographic, where we're going from 35 million to over 72 million folks. And just a note that our organization has over 65,000 members as of last year that were over the age of 100. So folks, 65,000. So folks are living longer, and we can talk a little bit more about the specific information for LA County, but we conduct surveys with our members, and so if you can see, and I'll read a little bit on the slide. So survey after survey finds that today older adults want to remain in their homes. So 78% of our members who we surveyed in 2014 said that they would like to stay in their current residence for as long as possible. But I think, as Mayor Sahli-Wells has discussed, we haven't designed a lot of communities with the framework of aging in place. And so a lot of folks are living in places that are really not, it's not a thriving environment. And so traditionally most homes are designed for able-bodied 35-year-olds. And so how do we, start changing that conversation? And so another survey has that 80% of adults age 45 agree strongly that they like to stay in their current community for as long as possible. And so we know, particularly here in California, affordable housing makes that particular wish a little harder, particularly if folks are renting, but also if folks own their homes. And we've seen a lot of instances where some of our members are what we call house rich but income poor. And so as many as, when you're on a fixed income, if the cost of living is going up, but your fixed income remains the same, sometimes it makes it very difficult to keep up with the bills that keep rising, but your income level stays the same. So some of the amenities that our members have talked about wanting to be close to home are a bus stop, 50% people said that, a grocery store, a park, a pharmacy, drugstore, a hospital, 29% church or religious institutions. We have train, subways, so more transportation, and some housing and entertainment options. So again, not very different from what we think about in terms of what we would want to see in a livable community. And also, a lot of these amenities that we can discuss is that, sometimes, as has been mentioned, you have to drive to these things. And so a fun fact, 1 in 5 drivers will be over 65 by 2025. And a lot of our communities aren't designed to support non-drivers. And so if you are biking, walking, or even taking active transportation, there's going to be a lot more of those modes that are going to be taken by individuals. One, because a lot of folks just don't want to drive, and some because they're going to outlive their driving privileges. And we've seen that in terms of DMV surveys that we take. A lot of female residents in California, particularly, we've seen this again with women. Their licenses get taken before male counterparts, but they actually live longer. So again, these are some of the realities that we have to make sure that we're planning for. And so our work is to ensure that the needs of older adults are at the forefront of a lot of policymakers' minds, particularly at the federal, the state, and the local level. And so we've been doing a lot of education, engagement, and advocacy work around transportation and housing. So in 2016, there was a sales tax that was passed by the voters in LA County called Measure M. I don't know if that I see some nods. And so we want to ensure that money is going back to projects that not only was, the projects that were promised to the taxpayers, but we supported that sales tax measure because we saw it as an opportunity to invest in transportation, quality transportation options for older adults and people with disabilities. And so we've been advocating to the Metro Board and its staff to ensure that quality transportation options for older adults is a reality as soon as possible. So really looking at the current state of what they offer and what they don't offer and how we can fill those gaps. How are we designing trains with the need of an older adult as opposed to a 35-year-old able-bodied person? And so that's some of the work that we're doing, as well as being able to support specific state policies. So this year we supported SB 50, which was very controversial, but that was a bill by Senator Scott Wiener to ensure that there would be affordable housing in transit stops, and being able also a couple years ago to support SB 1069, and that state bill enabled the resources and the building of accessible dwelling units, also known as ADUs. So again, being able to know that these are very complicated issues. They're not like one solution projects. And so being able to bring multiple solutions to the table to community to make sure that they are also voicing their feedback and input of what works and what doesn't work, and also empowering policymakers at the local level and the state level to have collaboration, but also some autonomy of what works in a community and what might not work in another community. And so this is the framework in which we operate. And again, I'll go through this a little bit quickly. So one of our projects is called the AARP Network of Age-Friendly Communities. In 2012, we established this network, part of the World Health Organization. We're the North American affiliate. And so cities and counties and states get to enroll in this network to be able to leverage AARP's existing tools and resources, but also to start thinking how cities can improve on policies and also support systems to support older adults and people of all ages. And so it is a multi-year process, and actually the city of Culver City was enrolled earlier this year, and so they've made the commitment to do a strategy framework on which we call them 8 domains of livability, but these are areas that a city can focus on. We're able to look at the built environment and the social environment, and I know that some of the panelists are going to talk a little bit more about that. But it's a wheel, and some of the issue areas that we concentrate on are housing, transportation, outdoor spaces and buildings, community support and health services, communication and information, civic participation and employment, respect and social inclusion, and social participation, which a lot of communities has really been linking it with social isolation, which is a big problem, not just for older adults, but really individuals in all parts of society. And actually, there's been a lot of studies that say that the predominantly rapidly growing problem is social isolation for individuals. And so we're making sure that we work with cities to put a plan in place to focus on the 8 domains of livability, to make sure that community features impact the well-being of older adults. And again, some of those features can be to improve health, to engage residents in these types of forums like you are here tonight, and create a sense of place and be able to foster home and community-based delivery services but also improving transportation and housing. And so I know that the city of Culver City is committed to make these changes, and so we are also here to support that work. And so I'm happy to hand it over to the next presenter, and we'll be here the rest of the night to answer any questions through the Q&A or even afterwards. So thank you all for being here.
Oh, you have to open it, sorry. I'll start talking while she's setting up the PowerPoint. I'm Gayle Haberman with the LA County Department of Public Health. The Department of Public Health is one of about 30 departments, depending upon how you slice county government, and we report to the Board of Supervisors as our ultimate bosses. Tonight, because public health touches so many things, I had to narrow that to 5 things. So really fast, I'm going to cover affordable housing, diverting people to care rather than incarceration, protecting public health near oil drilling sites, walkable and bikeable streets, and neighborhood parks. And I know many of you here are already well-versed in many of these topics. So I, too, have a diagram, and actually aligns really nicely with your 8 domains of livability in some ways. Can you guys see that? Not really? Okay. Basically, what this chart is saying is that public health, or population health, the health of large numbers of people, is affected 50% by access to medical care and health behavior. Do you smoke? Do you exercise? Do you eat healthily? The other 50% all relate to your livability domains. It's, do you have affordable housing? Do you have a good job? Do you have access to a quality education? Those are the social and economic factors. The physical environment factors are you living or going to school or working near sources of pollution? And do you have quality transit and housing? So the 50% in the lower part there, the social and economic factors and the physical environment, we have absolutely no jurisdiction over in the public health department. So we started working with cities about 20 years ago, imploring them to look at health as they made all kinds of land use decisions related to housing and transit and parks and walkability and bikeability. Because city leaders and city advocates, you are pushing forth public health. You're fighting for public health. You're doing what we can't do. And I also want to say, the 30% that's about health behavior, what you're eating, are you exercising, that's impacted by the physical environment. So it's not just that people are making bad choices, which is the narrative around a lot of public health issues. It's that they live in places where they can't walk to a safe park, or the streets aren't safe, so they're driving instead, or key destinations like a market, a post office, a school are too far away for them to walk to. Those are all land use decisions that cities make. We have made grants to cities in the past to develop general plans. We're so excited that Culver City is doing that because we see the value in laying out overarching goals about all of these land use decisions that will affect for the next 50 years all the specific developments that get made. So kudos to Culver City for developing a general plan. Let's see. Let's talk first about housing, and I'm going to whip through this. We look at housing as a public health issue because unaffordable housing causes all kinds of mental stress and prohibits people from buying healthy food, having enough money to go to the doctor. In addition, housing instability, if you have to move, is really hard on kids. We know that academic performance suffers when kids have to move a lot, and that actually teenage pregnancy rates and teenage depression are connected to housing instability. And of course, housing quality. Traditionally, we've been involved in issues like access to exposure to toxins in the house, but overcrowding also is a public health issue because it puts you to greater risk for chronic disease. I'm really proud that our Board of Supervisors in 2019 has passed a number of bold policies related to rent stabilization, just like Culver City, accessory dwelling units, density bonus. We have all kinds of draft policies, too, right now that were passed that are being studied that include inclusionary housing, where a certain percentage of all housing that gets built needs to be dedicated to low-income families. We're looking at that. We're looking at all kinds of other policies. I hope these are models for other cities. It takes a lot of time to research and develop policies. So know that other cities in the county are working on housing as well. I know that you all have been a leader as well. So John Kent and Richard Rothstein at the last session on Culver City's racist history talked about zoning. First of all, they talked about our racist past in many ways, and I encourage you to look at the video if you couldn't make it. It was an amazing night. I'm so glad I was able to go. They talked about that single-family zoning was a tool that city governments picked up when the Supreme Court made racial covenants illegal, where deeds, it used to be that it was in our own city, it said sell to whites only. Okay? That was replaced by single-family zoning, which basically said only rich people, usually white, can live in a certain neighborhood where single-family zoning takes place. They made the case that we need to look at our zoning code here in order to promote racial equity and get away from our segregated neighborhoods. So what that looks like is zoning that allows for single-family homes, apartments, condos, duplexes to all be on the same street. This is LaSalle. I think it's beautiful when you look at the mixed zoning. And if you think it's ugly, don't say anything, because this is my street where I live. This is the other side of the street, and it's hard to see, but that's a condoplex where I live. There's a triplex, and then a house. I just want to demystify that changing the zoning code means we have huge towers with 16 feet apartment buildings. But this is racial diversity. This is economic diversity. This is what it looks like. And design matters. As we move forward, what we've seen with cities is take the time to develop design guidelines. This is one of the prettiest apartment buildings on Jackson, which touches our condoplex, I think. And I believe that the majority of the people who live there are what we would call low-income renters and receiving Section 8 subsidies. And I'm thrilled that our neighbors and no one even knows. And I didn't even find that out until I took a picture this weekend. So let me move on to incarceration as a public health issue. Right now, LA County has the largest jail system in the country, with 17,000 people incarcerated at any given time. About a third of those people are mentally ill, and probably closer to a half if we look at people who are mentally ill and also have a substance use addiction. The Board of Supervisors is really committed to diverting people to care rather than putting them in jail. Because in the absence of community-based care, where we have access to affordable mental health services and substance use treatment services, jail is serving as our system of care. So we have a care first, jail last commitment, and I'm so excited about the city's the mayor sent me information about the new youth diversion program. This is a public health issue. The trauma that families face when one earner goes into jail or a child goes into the system, the ripple effect can last generations. I'm going to move on to oil drilling. So didn't even mention those reports. I'll say that at the end. We have a new one-pager out. I left some copies there, and I'm going to send them to Lauren so she can pass this along. We have a new one-pager out on the best that we can do to capture the health impacts of living near oil drilling. I know this is a huge issue for a lot of you, and in many ways you're charging ahead and leading the county. I really don't need to summarize for you the health impacts, but very, very briefly, we have 3,000 active wells in LA County, and many people live really close. And I'm actually going to go forward to the photos to show you. These are oil drills in Wilmington, within 100 feet of homes. This is a drilling site in Wilmington next to a park, and right across the street there's a bunch of homes, and this is our neighborhood, our community. So I just want to be honest that it's really hard to show a causal link between living close to an oil drilling site and health problems. The reason is it would take 20, 30-year studies that cost millions of dollars to rule out all the other exposures that people face in their daily lives, living close to a freeway, who knows, all the other sources of toxic emissions in the neighborhood. And really there aren't a lot of studies right now, but there are some, and here's what we're learning. There are short-term effects from living near oil drilling, throat irritation, headaches, dizziness, and then there's some long-term health impacts as well that increasingly the data are showing us, such as when you're inhaling these particles for long periods of time, you're at a greater risk of cancer and premature births. In addition to bad smells and noise and vibration and all kinds of effects, all kinds of things that can affect your homes. No one understands the effect really on emergencies because it's unpredictable. It's one of those variables. What would happen if there were a fire when all these trucks carting chemicals through the neighborhood to the drilling sites? What would happen then? What would happen if there was an earthquake? There's so many question marks. We, the Public Health Department, put out a report in 2018. And what we're trying to do, I'm sorry that you can't read that, what we're trying to show on this chart is that the more feet that separates, the bigger the distance separating houses from the oil drilling site, the more public health protections. And we went up to 1,500 feet to the chagrin of many community advocates who are fighting for a 2,500-foot buffer between oil drilling or obviously trying to sunset oil and gas as well. But at 1,500 feet, we say the air quality, according to our best data, is that it's safe from the perspective of air quality, noise, and odors. But there is no amount of feet where we can say it's safe to protect you from an emergency. And that's why the box in the lower right-hand corner is unchecked. I'm going to move on to walkable, bikeable streets. I first got involved and met the mayor when the Department of Public Health made a grant to Culver City to develop your bicycle and pedestrian master plan. And you've gone on to do so many other things that I'm amazed by listed here. Just to summarize the public health benefits for you of bikeable and walkable streets, it's everything that the mayor said in her opening. A reduction in air pollution if people are walking rather than driving. An increase in physical activity, because if you're walking and biking, it prevents all kinds of chronic disease. And lastly, the prevention of traffic collisions that disproportionately kill and injure pedestrians and cyclists. And I put that in red because I'm going to play that part up a little bit right now. You adopted, Culver City, a Vision Zero ordinance. I was digging around on the website. I couldn't see an actual plan for it. There might be one, and I just couldn't find it. We're encouraging cities to develop bold Vision Zero plans. Vision Zero is an international movement that says by a certain date that the city picks, there will be 0 deaths. And the reason this is an issue is that motor vehicle mortality in LA County is a leading cause of death for children 5 to 14. In 2017, there were 19 deaths. It's the second leading cause of death for youth 15 to 24. There were 152 deaths countywide, very close to homicide at 158. And it's the third leading cause of death for adults, entirely preventable. It's how we design our streets. Culver City is already doing great, I got this from the website, great analysis, but what this chart shows is this is 2005 to 2014. The majority of people injured when a car crashes, that pedestrians and cyclists are disproportionately impacted hugely. So the far right says 59% of all fatal victims were pedestrians of all the crashes here. So you have the data, we have this data, we encourage in Vision Zero, we say, look at your data and drill down. Why was a particular, and already you're doing it, you're mapping where the accidents are, and you need to drill down. Who's walking there? What time of day? How old are they? Is it about infrastructure? Is it about signal change? What is it? But it's I feel like you're on the right path, and in many ways you're a model for the rest of the county. There's ways to go to get to 0 deaths every year. One comment about speed. I'm sure you guys have read, anytime a city tries to do a road diet, it practically causes a rebellion among some people. And in public health, every time we have an opportunity, we want to share this data. Speed is a huge factor in preventing death. So if you're driving 20 miles an hour and you hit someone, 10% chance that they'll die. If you're driving 30 miles an hour and you hit someone, 50% chance they'll die. If you're driving 40 miles an hour and you hit someone, 90% chance that they'll die. So when we talk about slowing down traffic a little bit, it's literally a life and death situation. Where am I time? How am I doing time-wise? 5 minutes? Okay, just as some data for inspiration, New York City has already, with their Vision Zero work, really significantly lowered the number of fatalities. So traffic fatalities declined 29% after they made huge infrastructure improvements, and pedestrian fatalities declined 45%. So there are things to learn from other cities. Some best practices, and many of you probably know this, but community engagement is key, because opponents are going to come out and say we don't want any changes to the streets. And so we've got to try to win them over, but at least get the people who are open to streetscape changes out. And it's really hard for government. I'll say it as a government worker, I have not always done the greatest job getting people to meetings. And local nonprofits who work with the community all the time are much better poised to get them to meetings. And so we've now started hiring nonprofits and encourage other people, do the community engagement and go to where people are. Don't always hold a meeting like this. Go to a PTA meeting. Go to the schools. People trust their principals. There's better ways to do community engagement than putting up flyers and asking people to come to you. Also, take the time needed to contemplate complex policy solutions. That was my code word to myself because I couldn't put it on my slide. One of the biggest challenges is working with traffic engineers. I love them, and they're good people, and they're hardworking. But we've worked with probably 30 or 40 cities now on bikeable, walkable streets. They are trained to move cars fast. That's what they learn in engineering school. And so things are shifting now, and it is getting better. But one of the reasons for good community engagement is to really encourage cities to take risk and give cities the political cover. Our citizens want this. Our citizens want changes. In one city that I was working with, the city staff told me, our leaders don't even want to develop a bicycle and pedestrian master plan, because if we put in writing that we need improvements and there's an accident and a pedestrian is hurt or a cyclist is hurt, the bike ped master plan makes us more liable because we're admitting that our streets aren't safe now. So I don't know how you argue with that logic, except tons of people saying, take a risk, city. Other best practices, and I've seen Culver City do this, are putting up temporary streetscape changes so people can adjust, give feedback, work together with city staff to test out the changes. And innovate. We always encourage cities to innovate. Some cities will innovate, some cities copy other cities. There's just different kinds of cities in our county. Okay, really quickly, just to end here. Parks. If you live within 10 minutes of a safe park, we know that you'll walk to it and we know you'll get physical activity. They're also places to congregate, for people to recreate, and we know that it's good for mental health. Park improvements, like bike ped improvements, can trigger gentrification and causes of displacement. When I first started working on bike and ped and park issues at the county, I went to a coalition in South LA of nonprofits, activists, and church groups, eager to work with them on bike ped improvements. And they said, we don't even want to work with you. Because if we start making all these improvements, housing prices are going to go up, rents are going to go up because things look nicer, landlords can charge more, or just housing prices go up, and we don't want people to get displaced, low-income people. That's how we got into housing around 15 or 20 years ago. We bumped into the housing issue because people didn't want to partner with us on bike ped and access to parks. We can't ignore that. So now when we work with cities on these issues, we say you have to work on bold housing policies that prevent displacement and gentrification in tandem. And I want to mention two reports. The City of LA Measure JJJ a couple years ago was a transit-oriented development proposition on the ballot that would enable the city to increase density around transit and require a certain percentage of affordable housing to be built in all housing projects adjacent to rail. Our department did a study on what would the health impacts be if it passed. And we said, and just what would the impacts be? We said it wouldn't impede market rate housing from getting developed. And I can't even add two numbers together, so I had nothing to do with this health impact assessment. It was my colleagues. But we said it wouldn't affect development, and that would actually encourage a lot of affordable housing to get built, and that is what is happening in the city of LA. So if Culver City is looking at transit-oriented development, I strongly encourage you to look at this report. We also did a health impact assessment on the City of LA's mobility element to see would all the public health benefits of a good transit system ensue from what they were proposing, and all the things about decreases in air pollution and increasing people to walk and bike and decreases in accidents and collisions between cars and pedestrians. That's what our study showed, that yes, indeed, that a transit system designed for active transportation yields good public health results. To end, I just want to say, I don't know if you're familiar with the Countywide Parks assessment. You're shaking your head, yes. So Culver City's assessment, this was an assessment of all the parks throughout the county, and Culver City's a particular assessment did show that there are certain areas in the city in the western part and around Fox Hills, and those are the orange colors on the map, where ideal access to local parks is not yet present. So as the city does park planning, it's important to look at, from an equity perspective, which residents do not have the same access that everyone else does. And I think I'm going to end there.
All right. Good evening, everyone. I'm so glad the nice turnout, and thanks, Mayor, for inviting us. As she mentioned, my name is Louise McCarthy, and I run the Community Clinic Association of Los Angeles County. We are the coalition, all of the nonprofit community clinics and community health centers across Los Angeles. So that's from Antelope Valley down to Long Beach, from Venice all the way into the San Gabriel Valley. Countywide, there are 65 organizations that run over 350 sites and serve over 1.7 million patients, 1.7 million Angelenos each year. I like to start any presentation by centering myself in our members, and for this slide I wanted to specifically highlight our Culver City members, one of whom is hiding in the back. But at the bottom of the slide you see Aspire, Achieve, Inspire, and that is the motto of the Achievable Foundation, which is a community health center which is located within the regional center. So how appropriate that I'm on a panel with the head of the regional center here tonight. And there's also a photo of their provider in the center. On the top left-hand side is the newest arrival to Culver City, opening soon, shortly, stay tuned, in the former LA Weekly building. Well, yeah. The mural's gone, by the way, and we couldn't get zoned for a new cool one. But Westside Family Health Center is going to be located there, and they are doing a major expansion, which is super exciting. Yep, they are on Ocean Park still. And I don't know, Lauren, if you want to handle the little alert that's coming there. It doesn't. Yeah, so they are going to be relocating out of their spot on Ocean Park. And they're, about time. They are so crushed in there. I want to mention just that connection with, there's a lot of intersectionality between us on this panel. Westside actually one year gave the Blue Bus an award because that's how their patients get to the clinic. So when we talk about transportation, we talk about housing, we talk about food, what we in the health world call the social determinants of health. The things that make it hard for us to do the work in healthcare, those social determinants of health, transportation, housing, food, those are all things that end up impacting our patients when they come in. On the top right-hand side, you've got Venice Family Clinic. They've got a standalone site as well as a site within Culver High School, I believe. And then additionally, Planned Parenthood is here in Culver City as well. And they are all our members, and we're really proud to serve them. And the key piece is that these are health centers that are developed by communities to serve the community, and they see everyone regardless of ability to pay. And that is something that's really critical. I hope to help you become converts to community health centers by the end of this presentation. As a coalition, we ask our members every 5 years to say, what matters to you? What are your priorities? Let's set a strategic plan. And so as a coalition countywide for 2020, so we're getting ready for our next strategic plan to get developed soon, they said, integrate, innovate, and demonstrate. First, on integrate, we really need to look at how we integrate services, create one-stop shops so that people can get everything they need in one place. That's access to medical care, mental health care, dental, medical legal partnerships, any number of enabling services where you can put all in one place to support the community. That also means integrating with community partners and integrating our data so that you're not being asked the same information every single time you show up for a visit. They already should know. We need to integrate that. Innovate. There's the times change, federal governments change, political environments change, but in all of them we see that there's a need for us to do more with less resources. And so we have to be innovative about how we do things. We have to think differently. We need to not just, and people are judging us. The people that pay us, like LA Care Health Plan, the patients who come in our doors, the workers who want to come and work there, they're all looking and saying, am I an innovative place? And it's exciting that community health centers are places that have created some of the things that other folks are now just waking up to. So it's really exciting to see when Kaiser's copying us. I love it. Yeah. Thrive, we started with Prosper. So, and then finally, value. Value. We need to demonstrate our value. That's for the patients. And value means something different to everyone. For a patient, it's how long was I in the waiting room? Did my provider touch me where I hurt? Or were they so hung up on the computer trying to get the record to work that they never actually looked at me in the eye? For the health plans and the state, with their helping to pay for some of the services we provide, they're saying, are you saving us money? Are you getting people out of the hospitals that are more expensive? Are you finding ways to make our members happy? So they think, okay, the health plan is effective because the health center is effective. And then finally, workforce. We have a massive workforce shortage. In primary care, we are struggling for doctors, we're struggling for medical assistants, billers, coders, front desk, everything soup to nuts. We need our workers to know that this is a place that delivers value to you, as a place where you're experiencing an environment where your manager knows that yelling is not an effective management tool. It is. Hey, go figure. That you get to go home at night without a pile of work, and you're not bringing that home, but additionally, you're feeling that you're having an impact on the world around you. And that's a place where we really need to demonstrate value. And I think we're doing it. I know we're doing it. First of all, one of the exciting things about health centers is that they promote economic growth. Okay? We know that Google and Amazon are saying, who wants to give me a deal? I'll come to your town. Give me a deal. Well, they're going to move on to wherever the grass is greener when another incentive is offered. But the health centers won't. They will not. So health services generally, that includes hospitals, a bit large, you name it, health centers generate $141 billion in annual economic output in the LA basin. That's not chump change. Additionally, the healthcare industry is projected to grow by nearly 67,000 middle-skilled jobs between 2016 and 2021, with over 125,000 total job openings. We're hiring. And it's not just providers. You don't need to have a medical degree. A middle-skilled job is a job where you might have a high school equivalency or above. And the good thing about health centers, one of the many good things, is that they'll train you. So you might start as one thing and end up as something else. I met a woman today at a health center, our trans clinic in South LA. She started as an enrollment counselor, and now she's a clinic manager. Another woman there, she used to be a part-time security guard. There was just a temp. Now she has a full-time job, and she's a receptionist. So these are places where we create opportunities in the community, and we hire in the community. We also demonstrate excellence, and I like to brag about this one. We participated in a federal program where we helped our members in dealing with their patients with diabetes and depression. Through that program, we prevented 16,000 hospital visits, and we saved LA Care Health Plan $136 million. And my favorite statistic is that we were #1 nationwide on diabetes in this initiative. We outperformed the Mayo Clinic. All right? Thank you. And I'm from Minnesota originally, so I do know about cold. And yes, this is cold. But yeah, we are doing it. We are demonstrating excellence. Just a little bit, if you haven't been to a community health center and you don't know what it is that they do, you're going to be driving down Sepulveda past that building and saying, what goes on in there? Well, they provide comprehensive care, as I mentioned, medical, dental, and behavioral health. Behavioral health includes mental health as well as substance use services. What's really important is that we do a warm handoff approach. You walk in, we see you for one thing, you're getting your medical visit, and we notice you seem a little stressed out. Maybe you want to talk to my colleague. I'll bring my colleague in the room so that you can get services right there. We really, that warm handoff is a real key piece. And we practice team-based care. So the physician, we love physicians, but we know that all too often they don't speak the language. And I'm not talking just about language. They don't speak my language, when they're talking to me. So it's often the nurse, the MA, the other folks who can speak to me and help me understand how I can take an active role in my healthcare, and I can be at the center. It's called patient-centered medical home. We respond to community needs. One of the things that's really unique about the community health centers is that 51% of their board members, so these are nonprofits, they have to have a board of directors, 51% of the people on their boards are actually consumers of their services. So that makes a difference. When you've got people who are really actually there going into the clinic and getting the services saying, no, I want you to tell you about what happened on my last visit and what needs to change. And they're talking to their community. They do education and activities. It's not just healthcare services. There's a cooking kitchen at the site, the Venice site next to the Lou Collin Health Center on Braddock. Yes. Yeah, Braddock and Inglewood. They've got a cooking kitchen. So people can actually learn how to cook the foods that will help them stay healthy. And they pipe in video from the cooking kitchen into the exam room so that people are learning while they're sitting and waiting for their provider to come in. You can also, Westside, I know does, and I think a couple of them do Zumba I've never tried it, but hey. They do Zumba, other activities, and often it'll be with folks facilitating it who do have a medical or a behavioral health background so that they can help people in a more comprehensive way. They do work to mitigate the social determinants of health. I mentioned that the Westside's partnership with the Blue Bus. Venice Family Clinic is actually doing a food pharmacy. So they are prescribing foods and providing food to people that they deem to be food insecure when they come in for a visit. They're really looking at that and saying, how can I give you more? And they're partnering with a number of agencies to make sure that we do help people find housing. There can be medical legal partnerships. So they actually got lawyers in clinics helping people with housing issues, helping people with any immigration issues. You name it, these are all happening. And we partner with community agencies. I think the example of the Achievable Foundation and the Westside Regional Center is just phenomenal, because this is a place where they looked at things and said, we need to provide care for these individuals differently. You know, it's not a 15-minute visit. You can't get rushed in and out when you're a person with a developmental or intellectual delay. You need time. You need time to be able to really get to know your provider, for the provider to get to know you. And they've, through that partnership with the regional center and the referrals and referring back and forth and the connections that they've had, people being served at Achievable, some of them having their weight taken for the first time in decades, their first pap smear. You know, they're finding that by taking time, they can actually listen and hear people, especially if they're nonverbal. One woman who was wheelchair-bound had been in extreme pain and it had been ignored as a part of her condition. She had a broken hip. When she found the Achievable Foundation, that's when her condition was found and she was able to be treated. So we recognize, I just want to say that the intersections of everything we're doing here, there's a lot across this panel that I think we have in common. I just want to say, just for the AARP piece, one of the things that I really want to point out on the connection with housing and homelessness, when we did the homeless count 2 years ago, we found that there was an increase in seniors experiencing homelessness. That's inhumane. That's unacceptable. We are really looking at ways that we can partner, even thinking about transportation for our patients that have transportation issues. Our members are now using Uber Health and trying to get people to their appointments. And then finally, on the very side comment connection, is that I used to live on LaSalle too. So I didn't know that we were neighbors. But I appreciate that because I actually lived in a garage apartment on LaSalle, so I can appreciate what you said about having housing that is for everybody in our streets. So thank you very much, and I'd like to welcome my colleague up to the stage.
Well, these are some tough acts to follow. Thank you very much for having me this evening. I'm from Westside Regional Center, which you were speaking about, and we're here behind Fox Hills Mall. Just to give you a little bit of background before I go into, I want to talk about a specific program that we sponsor, but Westside Regional Center is one of 21 regional centers in the state of California. And it's a very unique system. In the early 70s, a group of families that had children with developmental disabilities got together and said, we need a better life for them. We need a community integrated life. And if you look at the history of individuals, what we support individuals with developmental disabilities like cerebral palsy, epilepsy, intellectual disability, is that once upon a time in the United States, many of these individuals lived very segregated lives, that they were basically institutionalized. They had segregated education, segregated housing, and like I said, for the most part, in institutional settings. Interesting fact, this week, one of the individuals we served was the last individual in our regional center to live in a state developmental center. And that's 30 years trying to get to that point or more. And what the mission is of the regional center system is to ensure that people with developmental disabilities have an integrated life, and access to the community just like everybody else. And we talked a lot about, this includes access to housing, access to transportation, health care, and employment. The Regional Center does 2 programs, just to give you a little bit of background on it. We have an early start program where we get a lot of bang for a buck. 0 to 3 children that have any kind of delay, speech delay, motor delay, born significantly premature, we're doing a lot of, right off the bat, is really doing everything we can to promote healthy development. And then partnering with the school districts, transferring these children into the school districts to give them the most optimal opportunity for success. A majority of these individuals end up more kind of coming out of our system at 3, and then we have a program from 3 throughout the lifespan, and we support individuals, like I said, throughout their entire lifespan. Things that we're focused on right now, there's a rule, it's called the final rules, federal program, it's called HCBS. I deal in a lot of acronyms all day long, and I think a lot of individuals do, but Health and Home Community-Based Services. And that it suggests is services being offered should be offered in community settings. So once upon a time we used to have vocationally you had what was called sheltered workshops. So all these individuals with developmental disabilities together working in a workshop. Well, there was a lot of advantages. It was great. It was an opportunity for socialization. It was an opportunity for work, skill development, a lot of great opportunities. But what basically you had all the individuals with a disability together in the same setting. And you didn't have integration. And the nice thing about living in a community is being able to be with all sorts of different individuals, and having diversity and having difference and being able to engage with all sorts of folks. Not just, I would certainly hate to be around, in a group with just individuals like myself. I don't know, that would be scary. So one of the things that I kind of wanted to focus on a little bit and kind of wanted to sell, because I think it's a phenomenal program. What we're working on is really trying to get more of the folks that we support into employment situations. And recently legislation was passed that set up a paid internship program. And I'll tell you a little bit about that. So the mission obviously is promotion of independence, full integration into community life through competitive integrated employment. And the paid internship program is an opportunity that basically gives funding for prospective employers to employ individuals. And it allows acquisition of experience, skills for future in paid employment. And the idea, the hope, the aspiration is that these individuals will acquire full-time employment, obviously. So basically what it is we have funding for prospective employer who would bring on an internship, and we pay them $10,000 in that year to train that individual. Regional Center will also provide supportive employment coaches to work with those individuals in that setting. And the hope is over the year that you'll find that this will be a good prospective employee. Today I heard a story that just happened today. We had a young man who had a paid internship program at Petco. I think it's right nearby here. And he loved his work so much. One day when he wasn't scheduled, he just showed up and said, "Hey, do you have anything for me to do?" They said, "Well, you're not scheduled today, but actually one of the other people didn't show up today. Can you work?" Absolutely. And he was only typically only work 2 hours, and he had a coach there with him. Coach wasn't there, and he ended up working twice the shift. At the end of the shift, they were so grateful, they said, "You know what, we're going to hire you." And so today he was offered full part-time employment there. Yeah. So the internship wages will be at least state or local minimum wage. That's what we're looking for. Individuals, sort of the guidelines, 18 to 22 years. And there's no minimum or maximum rate requirement. Some facts that I wanted to highlight about individuals. We have at Westside Regional Center, we actually have 10 individuals that we support right now that are working full-time for the agency. Well, some full-time, some part-time. And they're phenomenal employees. I had an all-staff meeting, and the last all-staff meeting that I had was we have these stars that we give to really model employees. And I gave one of the young ladies who's working for us full-time because we had all of these we had all these crises that kind of happened at the same time. And every time we were looking for somebody to help out, she was right there in the front of the line, like, what can I do? And really got us out of a bunch of crises. Things that I could tell you about individuals with disabilities that are in the workforce: they're rated higher, have less sick days, low absenteeism, 90% retention, that they don't end up leaving, lower turnover, low cost supervision, very devoted, quality employees. And the idea, so that there's no cost to the employer. So you're basically getting free labor. The state is picking up the cost of those individuals. And, I know we talked about health care, housing. I wanted to focus on this because, we're kind of, right now, it's an opportunity that we have, and being in Culver City is really trying to get the word out that we have this program, and I have flyers that I have available, but if you know anybody, any businesses, local businesses, this is a great program. The feedback that I've gotten from the community, I've gone to the Chamber of Commerce meetings, has been very positive, that there's a lot of businesses that have really reaped the rewards for this really unique situation. And the idea in general, again, is community integration, is that we have a diverse and rich community that everybody can participate in. And that's it. I'm going to be short and sweet because I'm the last one on the on the board, and it's a tough act to follow. But I really appreciate the opportunity to speak to you.
Thank you. It's so inspiring to hear about ways that we can become a more thriving, inclusive, successful community. Culver City is a great place. We've got a lot going for us, but there are definitely gaps that we can fill to be better. And I'm just excited just at how the different voices at this panel, some of the through lines like housing, and its importance in health, I think really speaks to a lot of the type of work that we're trying to do as a city and accomplish right now. We have time for a couple of questions, so if anybody has any questions for the panelists, now is your time. I've got my colleague in the back, Daniel Lee. Okay, we've got over here. Hi. Do you want to use the mic? Sorry.
Hi, my name is Jennifer Fairchild, and my company, unfortunately, it's based in Delaware right now. I have to do my, foreign, but I want to work with you because, see, I'm a producer, writer, director, and my company is Fairchild International Studios, LLC, and I definitely want to get people involved in the development of television because I write television, and I'm all about inclusion. So, a prerequisite that people... A prerequisite that I require for my company is that they have to sign a non-disclosure agreement regarding intellectual property, because I know you know what happened with Fox News and all that. I'm not going to take advantage of young men or young women. I'm all about, treating everybody with respect. But how long is the term for the paid internship program? That's my key question.
Thank you.
So it's typically 1 year is the expectation, but I don't think they've put a specific on it, and I've actually got a handout for you because it's got frequently asked questions like that, and there might be other questions, but typically it's 1 year.
All right, Daniel.
Yeah, no bureaucracy here.
I'll try to be quick because I got a couple questions. For Stepahanie, in terms of social isolation, is there any type of policy or program that focuses on intergenerational integration and trying to get some of the young kids who can't afford housing possibly to work with older folks? For Gayle, does the Department of Public Health, I know since causation and correlation are hard to prove with oil, do they use any of the data from Cal EnviroScreen on the cumulative impacts of pollution from various sources as a means to make an argument rather than just focusing on oil? For Louise, for the community health centers, are you going to consider being a place where children can be screened for trauma, since the Surgeon General has recommended that all school-age children be screened for trauma? And then for Tom, yes. What's the biggest absent consideration for individuals with developmental conditions that cities are not addressing? It seems like the answer is jobs. And also, have you worked with Otacon here in Culver City?
All right. He did the whole panel there.
All right. Well, I just think I want to move to Culver City because this is pretty amazing. Just the turnout, and I loved, Jennifer's question. And the best part was that she just came and grabbed the flyer, which was amazing. I told Gayle, I was like, no bureaucracy here. Talk about a great, really community. Seriously, it's great to see. It's really inspiring. So to your question, I know that for isolation, there has been more work done in Scandinavian countries. Like a lot of Scandinavian countries are doing more of that intergenerational work. So one of the things that pops to my head is that they put senior housing right next to child care centers. And so the seniors, and especially a lot of seniors who have dementia, are able to play and have interaction with young children, because there are studies that show that dementia symptoms are reduced when patients get to play with small children, and they actually find that comforting. So a lot of Scandinavian countries have done more of the intergenerational. There is an organization, and it's escaping me, but I'll look it up and give it to you, here in Los Angeles, that is starting to do what they call is like a buddy system. So if there is an older adult that wishes to maybe rent their a room in their house for a reduced amount in support of, let's say, maybe some caregiving services. I mean, it's like a contract that's worked out between them, then they're able to do that. And so far that I know, most of those housing, it's like co-living situations are done between older adults. I'm sure, like, informally there could be sort of that intergenerational living, but from what I know of more like formal, it's still within sort of like older adult and older adult. But there are programs I just think not that at least that I'm familiar with in Los Angeles that's really doing that intergenerational initiative. There's one initiative in USC that's looking at millennial caregivers for older adults, and I could provide more information about that. Who's that? Okay.
So that's a great question, Councilmember Lee. So the question was, since we don't have causal data for LA County linking health impacts to exposure to oil drilling, do we use Cal EnviroScreen? And Cal EnviroScreen is a composite index that draws from multiple data sources to say X community is exposed at this level to environmental emissions. And we have produced maps that show in LA County these communities have the highest score, which is a bad thing for Cal EnviroScreen, to show that they're exposed to what we're calling cumulative burden. So in some the problem with permitting, the way permitting works in many cities is a dry cleaner wants to open, and they go to the city and they say, hey, can we get a permit? And they're emitting within the normal range, and they say, sure. And then the next day, maybe a gas station wants to open, and the next day, a recycling plant. And over the past 10 years, this issue of cumulative burden, the need to look at, okay, this community now has a gas station, an auto body shop, and all these sources, and no one is looking holistically as the permitting process is taking place. And the city of LA passed green zones, I'm sure you know, 3 years ago to say, okay, these neighborhoods are so overburdened cumulatively by exposure to so many different industries, we're putting a pause, we're putting in place different permitting processes. The county in the unincorporated areas is currently developing a similar green zones program. It's not up and running yet, but it's a great question, and I think it's really, really important thing to do, to look at that cumulative exposure.
Okay, do we remember what his question was? That's your city councilman with 4 questions for 4 panelists, so the man's prepared. He asked about adverse childhood experiences. We now have a Surgeon General, the first Surgeon General in California, Nadine Burke-Harris, and I encourage you to check out her TED Talk. She's phenomenal. I have a crush on her. She's just amazing. But she found when she worked in San Francisco at a community health center, like the ones I represent, that she couldn't help her patients get healthy. She had one patient in particular. She's working with this little girl who has asthma, and her inhaler just isn't working. And there is science behind this that says if you are exposed to adverse childhood experiences, this could be violence in the home, this could be poverty, this could be any number of things, medications won't work. Your body will not accept the medications. She's working with this little girl trying to control her asthma, speaks to the mom and says, what is it that's triggering her asthma attacks? And she says, well, I do notice she seems to have an attack anytime her dad punches the wall. That is an adverse childhood experience. And so she is actually now put out, so that we are going to be doing, for our Medi-Cal population, for folks who are on Medi-Cal, we are going to be screening every child for adverse childhood experiences over a period of time, checking them. And we are going to be doing these screenings. It's called ACEs Aware is the campaign. And the state is actually going to pay providers to do this. They're launching trainings that are starting right now. The first webinar happened last week, and it's really a 101 training. The thing that we're really working on is to say, now that you've screened someone for ACEs, it's a fairly simple screen, and they come up with a score, a number score, and if you're over a certain number, it means that we need to find some way to help you. Our goal is to not just have the state offer a 101 training, but a 201 training, and then actually work with providers and other community-based organizations to say, where are the resources to support people to make sure that we can mitigate their adverse childhood experiences and not just identify them, because it is a concern that if a lot of folks just do the screenings, and even the patients are getting screened, the more times they're screened, they're thinking about this and they're saying, man, what's wrong with me? I've got all these problems. Or the providers are going home at night saying, I can't do anything about this. So it's an initiative that we're working with the Center for Youth Wellness. Dr. Burke Harris, the Surgeon General, was a founder, and she was executive director there before she became Surgeon General. And so we're working with that organization to really say, how do we create trauma-informed environments so that we can do these screenings, and everyone from the security guard to the front desk to the provider is really looking and knowing and being trauma-informed in how they interact with the clients who are coming in, and we're creating robust systems of services and supports to make sure that we're actually able to get them resources so that we can address those adverse childhood experiences.
Well, as you were asking questions, I was going, well, I don't think he's going to ask me a question, because I was the last one, and then, of course, you got all of us. So good questions. The first one, I'll take the easy one, AutoCon. Every year we have an employment fair, and AutoCon was represented at our last one. They came in and they had a booth, and it was what the employment fair does is individuals that we support, they come there and they get to meet prospective employers. They also get help with developing a resume, interviewing, all sorts of like kind of pre-job skills. And we had the Census Bureau was represented, the U.S. Postal Service, we had TJ Maxx, we had AutoCon, we had a number of prospective employers that showed up. It was great, and they were represented. And I kind of missed a part of your question, but I think you were asking what are some of the greatest challenges in the different areas like healthcare, employment.
Well, what aren't cities providing that they could?
What are not? Okay. Well, I think in all areas we have challenges, really. One of the things I'd say, like in healthcare, and we started the partnership with Achievable. Achievable was a nonprofit that was initially like kind of a fundraising arm that was associated with Regional Center. And one of our biggest challenges is that we could not get individuals with developmental disabilities into community healthcare clinics. They weren't getting the same quality of care. And what started happening, we had a phenomenon where some providers were going out and providing care, but it was really suboptimal. They weren't getting specialty care that they needed. They weren't getting the time, and because they weren't able to advocate for the health care needs. They just weren't getting. They were getting not good quality care, not good specialty care, and so that's been a big push that cities really, and I really want to say thank you to Achievable and to the healthcare clinics, because that has really helped us to expand our options, but we have a long ways to go. Transportation has been a big issue. We've had to kind of rely on, we vendor with different transportation services. I've got a number of individuals that we support here that could speak to the fact that a lot of these transportation services, they're difficult to kind of to arrive on time, to get you from point A to point B. And in Los Angeles, I think we've made a lot of gains, but having good access to public transportation has not been a strong suit because we're such a metropolis. And obviously one of the things here in Los Angeles, and I know this is a challenge for everybody, it was a challenge for me personally, is affordability, affordable housing. And I think that as we become more and more inundated, and you look at housing costs, and you look at rents, and you look at housing costs, that this has been a very challenging area for us, that people just can't afford. So we have to be very creative. And I appreciate some of the recent legislation looking at people being able, looking at zoning laws and looking at our ability to do add-ons to homes so that people, because a lot of families trying to create situations in their homes, converting their garages, doing ADUs where people can live. And that's sort of out of necessity now, is that people have to start living with families. It's harder and harder to kind of move out and live on your own. So it's kind of, I don't know if I could say one is worse than the other. I'd say that they're really a kind of a triage, and they're all very challenging in their own right.
All right. Well, we've run out of time, but if we can indulge one more question, if folks want to be patient and stay for one more question, we'll make it short. Come on up.
I just want to say that, yes, we do have in our city, I love the city, I've been born and raised in Culver City, and yes, we do have gaps, yes, we do have challenges, but I'd like to try to close one, and I would like to invite anyone that perhaps you see someone with suffering with malnutrition, who are suffering because they cannot afford fruits and vegetables. I invite them. I'm a volunteer at Say's Food Bank, the only food bank in Culver City, and we can give them an emergency bag of vegetables. We've tapped into the farmer's market. I pick up the leftovers at night, and it's quite astounding how much good nutrition can help health. And I thank you very much.
Thank you for that.
Wow, thank you.
Thank you. The food bank is called Saves. Yeah. St. Augustine's Church. Well, thank you all so much. I want to thank you for attending. I want to give a shout out, of course, to our outstanding advanced planning staff, the Dream Team, for the general plan update. We've got also members of our general plan advisory committee who are here. If you want to stand up and be recognized. Thank you for coming, and thank you for being part of the planning of our city. Of course, thank you to the Achievable Foundation. I'm thinking Achievable Foundation. Thank you to the Exceptional Children's Foundation for hosting us. This is another outstanding provider of services in our city. And we do have an activity where we're trying to get your feedback. That is, if you saw it on the way in, there's a map of Culver City. It lists some of our health assets that we have, and maybe by looking at the map you might see some of the gaps as well. And so we're trying to get your feedback to help inform our general plan update. So if you have a little time on your way out, please feel free to engage with that. Did I remember everything? All right. Thank you again for your time, for your thoughts, and I'm really excited that we're doing our general plan update. It's this outstanding time for us to come together as a community to do better and to support one another so that we can all thrive. So thank you.
Thank you for setting everything up. Thank you.